Welcome back to the deep dive. Today we're on a bit of a critical mission, I think.
I'd say so.
We're going to drill down into what is probably the most surprising evidence-based secret to long-term health and well-being.
Yeah.
We're ignoring all the fleeting trends for this one, the latest detox or biohack, and we're focusing on the single biggest predictor of longevity, of mental strength.
And you were so right to call it surprising, because all the conventional wisdom, it just steers us towards money or career success or, this relentless pursuit of physical perfection.
That's not it.
But when you look at decades of longitudinal data, that's just not what pops out.
Not at all. Our sources, and some of these are the longest-running human studies on the planet, they all point to this one really non-intuitive finding. The healthiest people, the happiest people, the ones who live the longest,
Right.
they're the ones with the most satisfying, meaningful relationships.
It almost feels countercultural, doesn't it?
Yeah.
In a society that so often rewards just solitude and the grind. But the science is it's unequivocal. This isn't about fame. It's not about how much money you have. It is about connection.
People who listen.
Having people who genuinely listen, who love you, and who make you feel fundamentally safe in the world.
And that, for me, is the fascinating part of this deep dive. We're moving past just the emotional appeal of that statement, as nice as it is.
Right.
We're here to understand how does that feeling of connection physically, change your biology. We're looking at relationships as an actual biological force.
That is the key distinction. We are leaving the realm of, say, philosophy, and we're entering the realm of psychoneuroimmunology.
Okay.
Social support isn't just this comfort blanket. It is a physical modulator that directly influences your body's major internal systems.
So let's start at that immediate level then, the brain. If I'm having a really difficult day and I call a trusted friend, how does that conversation physically manifest as a health benefit?
Okay, so it starts with these neurochemical effects that immediately reduce anxiety and stress, almost instantly. When you feel heard, when you feel understood, you get this powerful release of oxytocin.
Bonding hormone.
Exactly, that's what everyone calls it. But structurally, it's a brilliant anti-stress agent. It actively works to lower cortisol, which is your primary stress hormone.
So the feeling of trust, of safety, it's literally a biochemical delivery system that minimizes the damage from stress.
Precisely. Think of it as an antagonist to the stress response. If you're stressed out and you're alone, cortisol just keeps cycling, causing damage. But if you have that supportive interaction, that oxytocin release helps pump the brakes.
And I imagine that ties directly into how the brain manages emotion regulation, which is where things get really technical and interesting.
They do. So supportive relationships, they actually stimulate the prefrontal cortex, the PFC.
Which is right behind your forehead.
Exactly, right there. And you can think of it as the command center. It's what's responsible for your executive functions, for planning, and this is crucial. Putting the brakes on those impulsive emotional reactions.
Yeah. So if my PFC is stimulated by stable connection, how does that really translate into better stress management than someone who's, say, socially isolated?
Well, think of it this way. In people who are isolated, stressors can often bypass the PFC entirely.
Oh, wow.
And they trigger this immediate, raw, reactive response from the amygdala, the brain's fear center.
Love or flight.
Pure fight or flight. But when you have supportive relationships, that safety net means the PFC is consistently engaged. It's well practiced. It intercepts the stress signal. It processes it calmly, and it dampens that emotional intensity. You are literally better equipped structurally to handle external threats.
So it's not just that you're coping better emotionally. Your entire regulatory mechanism is fundamentally healthier.
It is. And you mentioned this influence is sweeping, and it really is. It touches every system in the body.
Every system.
Your relational health. It speaks to the immune system, the cardiovascular system, the endocrine system. It shapes your inflammatory responses. We're now finding that the social environment influences everything, even down to which genes get expressed.
That brings us to quantifying these benefits with, hard markers. Let's talk about inflammation. It's at the root of so many chronic illnesses.
Right.
What do researchers actually look at to prove that connection reduces disease risk?
So we look at specific inflammatory markers that are circulating in the blood. The two major ones in this area are interleukin-6, or IL-6, and C-reactive protein, CRP.
And these are bad news if they're high.
IL-6 is a key pro-inflammatory cytokine. It's basically a signaling molecule that tells your body to ramp up inflammation. And elevated CRP is a standard clinical marker that doctors use to predict cardiovascular disease risk.
So if you see high levels of these, you know the body's in a state of chronic, low-grade internal conflict.
You got it. And the data from researchers like Kiko Glaser and others show that positive social ties actively reduce the baseline levels of both IL-6 and CRP.
So wait, if you're socially connected, your inflammatory response is just calmer.
It's calmer, which reduces your risk for everything from diabetes to Alzheimer's.
That is just profound. It suggests that a good social life is a better inflammatory suppressant than a lot of pharmaceuticals.
In many cases, yes, because it's addressing the root cause, chronic stress. This also ties into the concept of allostatic load.
We've touched on this before. That's the wear and tear, right?
It's the wear and tear. It's the cumulative cost to your body of constantly having to adapt to stressors.
So if you're living that grind culture life, that constant effort and adaptation, you're just racking up allostatic load.
Precisely. If you are isolated, every minor stressor, a bill, a traffic jam, a difficult meeting, it requires this intense physiological response. Your heart rate increases, blood pressure spikes, cortisol releases. The body is constantly pushed into overdrive, and that repeated effort creates damage across all your systems. Supportive networks. They manage this load. They provide that immediate support, allowing your body to return to baseline much faster and more efficiently.
It's the difference between trying to paddle a boat yourself in a storm versus
Being securely docked, a
Yeah.
perfect analogy. And this protective effect, it starts from day one,
You mean in childhood?
from birth.
Yeah.
Let's talk about early development and the HPA axis.
Okay, that's the hypothalamic pituitary adrenal axis. It's the body's central stress command system.
Yes. And children who are raised in emotionally secure, supportive homes, they develop healthier HPA axis feedback loops. The system becomes highly efficient.
So when stress hits,
When stress hits, the HPA axis releases cortisol, but then a well-regulated system signals the brain to stop that release once the threat is gone.
and what happens in children who don't have that emotional safety net?
That feedback loop can become dysregulated. It gets stuck on. The system is either chronically hyper-responsive or, on the other side, it can become dampened and exhausted.
Wow.
Research has found that a supportive environment basically lays the blueprint for a calmer, more robust regulatory system that lasts a lifetime. You're not just learning to cope, your actual stress physiology is being optimally constructed.
And as we move into adulthood, I assume that robustness translates into cardiovascular protection, which is such a huge finding.
It really is. Social support reduces cardiovascular reactivity to stress. So when someone without support encounters a stressor, their heart rate and blood pressure might spike dramatically.
Yeah.
For those with strong support, that physical response is far less intense. Strong relationships literally act as a shield for your heart.
We have foundational research showing that a supportive marriage can reduce overall cardiovascular disease risk. It's just hard evidence that your emotional life translates directly into your heart health.
And that's the key takeaway here. Relationships move far beyond just improving the quality of your life.
They make it longer.
They make life longer. This is the ultimate profound shift in understanding this.
And when you look at the raw mortality data, the statistics are genuinely shocking.
They are. We have to talk about the groundbreaking Berkman and Symes study from way back in 1979.
Okay.
They found that people who maintained the fewest social ties had more than double the risk of mortality compared to those with robust social networks.
Double the risk. That's on par with the most recognized life-threatening habits we know about.
Exactly. It puts social isolation right up there. And further meta-analyses, synthesizing data from millions of people, they've confirmed this. Loneliness and social isolation increase your overall mortality risk by somewhere in the range of 26% to 32%.
That's why this is moving from just a sociological issue to an acute medical one.
It has to.
Do we see this risk get even worse when people are already battling a serious condition?
Oh, absolutely. There was a study that focused on adults already diagnosed with coronary artery disease. They found that the socially isolated adults with this condition were 2.4 times more likely to experience cardiac death.
So when your body is already compromised, that support system becomes a literal lifeline.
It's a crucial reservoir of resilience. It protects your survival mechanisms.
And these numbers are so relevant because we're not just talking about historical data. We are in the middle of what experts are now calling a loneliness crisis.
And it is spiraling. A 2020 report showed that over 1 in 5 Americans feel lonely or socially isolated on a regular basis.
1 in 5.
Despite being digitally connected 24/7, we are struggling with real, deep, meaningful connection.
And this has now escalated to a public health danger. It's demanding the same level of focus as obesity or addiction. This is where the statistics become, well, truly urgent. The U.S. Surgeon General, Dr. Vivek Murthy, he addressed this just recently.
Yes, and that comparison he made is the crucial insight everyone needs to hear.
It is.
Dr. Murthy stated that loneliness is now considered a public health crisis with dangers comparable to smoking 15 cigarettes a day.
Let's just pause on that for a second. 15 cigarettes a day.
15.
Most people immediately understand the biological toll of a pack-a-day smoking habit. To equate the physiological strain of chronic loneliness to that level of toxic exposure it's staggering.
It's not just an emotional drain, it is rapid physical decay.
It forces us to understand that isolation is fundamentally damaging our arteries, our brains, our immune systems at a rate equivalent to a known carcinogen.
Right.
This reframes the entire issue. It's not about feeling sad, it's about survival.
And through all of this, the neurochemistry, the mortality rates, the public health warnings, the central conclusion is just always the same. Whether you look at mental health or physical longevity, the people with the most satisfying relationships, they win. It supersedes wealth, status, fame, all of it.
Which brings us to the application, right? If connection is the most powerful medicine we have, the question for you, for the listener, is what intentional action do we take?
And the sources are pretty clear on this. It's a simple, though maybe challenging, substitution.
It is. We need to replace a little bit of our screen time with actual, real, human time. It requires intentionality.
It does. Because social engagement is now an investment in your physical infrastructure, not just your emotional mood. The concrete examples are what matter here. We need to seek out face-to-face interaction.
The stuff that stimulates that oxytocin release and calms the stress axis.
Exactly.
We're talking about simple acts. Call someone. Don't just text them. Hear their voice. Visit someone. Sit down and laugh with a friend. These aren't luxuries. They are fundamental acts of biological maintenance that directly regulate your nervous system and fight inflammation.
We have to shift our perspective. We have to view this investment in relationships as the best long-term health insurance policy you could possibly have.
It's about building your circle.
Building your circle, maintaining those bonds, and this is crucial, allowing yourself to be vulnerable enough to let that circle support you when the inevitable stresses of life hit.
What really stands out to me most profoundly is that our greatest hedge against disease and early mortality, it's found right in our personal relationships. Not in a supplement, not in a diet, not in any material accumulation.
That's the synthesis of all of it. And we can leave you with the distilled wisdom from the Harvard study of adult development. This is the longest-running study on human flourishing. After decades of observation, they concluded with one single, perfect thought.
The ultimate wisdom, backed by all this hard science, the good life is built with good relationships.
So as you integrate this deep dive, let this be the final instruction you mull over. Take care of your people, and let your people take care of you.